And we're back with our third and final segment for this episode, our first ever rapid fire episode on PHAMCAST. But this is going to be a regular thing with a different guest because it's just so powerful. We're covering so much. So let's dive right back in right away. So what's one underrated lab test that everyone should consider?
Easy, fasting insulin.
Okay.
Fasting insulin is, we are in a chronic disease epidemic. Most of these diseases are metabolic, and fasting insulin is the canary in the mine shaft, and it is never checked. It blows my mind. There is no disease that isn't metabolically aggravated,
right,
or driven or propagated or perpetuated. And yet we look at fasting blood glucose or A1C, which are so far down the line that's eventually when someone's A1C finally goes, their insulin has stopped working a long time ago. But you will always see elevated fasting insulin first. Always. And I can't tell you how oftentimes we'll see 5.3% on the A1C, 5.2%, 5.4%. And just for the audience, anything over 6 becomes problematic.
Right. So they're close.
Not really in percent, not in his A1C.
Sorry, yes.
Yeah, so A1C, like a 5.2 as an example, or 5.1 is almost optimal.
Right. Sorry.
You're thinking of fasting glucose.
Yes, correct.
So yet you will still see fasting glucose or fasting insulin in the 100s, 150s, 200s, 250s. And optimal insulin is less than 50 picomole per liter. In cancer patients, especially if they have aggressive cancers that are highly glycolytic, as insulin goes up, their risk of death goes up. If we can bring insulin down, everything starts working. Mm-hmm. Chemotherapy works better.
Right.
High-dose vitamin C works better. Mistletoe works better. Everything works. Inflammation then, which dovetails from insulin, also comes down. So the fact that in this epidemic, when we're trying to make a difference, and yet not one family doctor in my community, probably not across Canada really, runs fasting insulin. Not only that, patient asks for fasting insulin.
Yep.
But they'll actually get, is it necessary?
Right. Right.
Like, hell yes, it's necessary.
And these are important things to raise. Thank you for doing that, Dr. Rallis, because one of the things that this movement and what I've always done through my whole career, but this movement in particular, is to really help coach and guide and empower to prove health esteem for people so that they feel courageous enough to ask those questions of their physician. Most patients don't want to do that. They just listen to the doctor. Oh, I can't ask the doctor that. And I've done so much coaching in the last 3 years since selling my clinic, just on encouraging people to have their voice heard with their physician. We talked in our first show together, the importance of the patient-doctor relationship and that it's not a pedestal in a one-way conversation.
No.
That it is about working together. That's not the way our system's been set up. It's not the fault of the physician. It is the way medicine is taught, and it's what we've all bought into, but it's really helping to give them permission with some skills, not to challenge the doctor, because, they're going to be seeing us challenging their doctor.
But that's how the patient feels.
That's exactly
That's how the patient feels. And I would urge any doctor that's actually listening to this to take offense. To say, this is total bullshit. I'm offended. Great. You should be offended. I hope you're offended. And then challenge it. Are you treating that patient like somebody you love?
Right.
Are you looking at them? Are you actually trying to prevent disease? Are you looking at all those biomarkers? Because the normal set of labs does not screen for anything. So why are we even running it? Unless you have some deleterious end-stage disease, nothing is picked up.
It's nothing prevention.
Not in terms of mental health that we talked about, not in terms of metabolic disease, not in terms of virtually nothing is picked up, not in terms of inflammatory markers never checked.
Which is the foundation.
Liver markers are hardly, like AST is sometimes checked, or ALT, one of the transaminases.
Right.
Look, nothing is checked. Why are we even running them?
Right.
The system is not the system is so broken that you can't even comprehend it. And I would want family doctors to be watching this and to say, I totally disagree. I completely disagree with this. This is like, and then dig into it.
Yeah,
and
get
run
curious.
yes, get curious. Run insulin and inflammatory markers and all of these markers on your patient and go, oh, wow, they're not very good. And you then begin to see the timeline of the disease and what's going to happen with that patient.
And imagine being able to intervene before, so we don't end up with
primary care
cardiovascular disease.
providers.
Correct.
It's their primary care provider.
Correct. Yes.
I had a patient that came in with fatigue. Thyroid wasn't checked. B12 wasn't checked. I mean, there was no marker. Ferritin wasn't checked.
Which is iron, for anybody wondering.
Yes. So it kind of blows my mind. Like, either people are mailing it in and just working on, well, it's a Medicare system, or they don't care, or they're pissed off. But do you love that patient? Is that what you would check for yourself? And yet in the States, we have a guy like Mark Hyman. I just looked at his lab panel. He had 400 tests on there.
Yeah.
Every hormone is checked. Every biomarker is checked. Are some of them extraneous, overdone? Maybe, but they all tell a picture of what's happening physiologically. And when you put that picture together with expertise, which these doctors have,
right,
and they would be able to put it all together, but you can't tell what the picture is if it's a 5,000 piece puzzle and you're using 4 pieces and then expect to go, oh, it's the Mona Lisa.
Right.
You wouldn't know shit. You can't tell what it actually is.
Right.
So it just blows my mind. And then the patient walks out, oh, I'm healthy. No, you're not.
The alarm bells just start ringing.
Until something goes wrong, catastrophic. Oh, then I had a gallbladder attack. Oh, I had a heart attack. Oh, I have interception in my bowel, or I have this, or I have that, or I have on and on and on and on.
And then, of course, the comment is always, well, these things cost money. But then if we look at the other side of not investing in prevention, and this is what this whole movement is about, we can save so much for quality of life aside, but in terms of strain on the system, do we want to invest in some blood tests and looking at biomarkers and helping people learn lifestyle so that they can be more proactive and preventative? Or do we want to be at the end stage where maybe we're going to be having surgeries that cost thousands and thousands of dollars, and the strain on the system is even more? It is a complete and utter mind shift and the way we're looking at healthcare. And I know we've been on this journey climbing uphill for years. But we are seeing some hope coming forward, right?
Yes, we are.
And we're going to talk about that in a minute. I want to get a couple of more questions answered before we talk a little bit about some of the projects we're working on together. Let's see here. We're talking about performance and optimization. What's one non-negotiable in your daily routine?
Non-negotiable in my daily routine. Waking up, loving the person you're with.
Connection.
Loving the people you work with.
Loving yourself.
Yeah. I think if you naturally love, if you get good at that, if you love your partner, if you love your kids, love your pet.
What if somebody's sitting at home and they're divorced and they've been hurt and they don't know where to turn? What do you say to them?
You walk out of your apartment. If someone says hi to you, you love the fact that they're there. You love the fact that they're a human, living, breathing, trying to get through this as well. You get on the bus, you look at that bus driver, you love them. You sit down with the person beside you, you see the struggle that they're going through, carrying their bags, maybe being disheveled, and love them for the journey and the struggle that they're on. And the more you practice this, you then begin to feel everything begins to unlock. We're born. I remember when my kids were born. These were the most profound moments. We had the best family doctor. My family doctor came late, birth of my first son, and she allowed me to deliver my oldest. And she watched as I pulled him out, and this little baby, and our second was the exact same. They were like basically carbon copies. The baby, she took the baby and then went to Michelle and started breastfeeding right away. And I thought, that was the totality of humanity. It's love,
Yep.
unconditional love,
Yep.
physical connection,
Yep.
and whole food.
And community.
And really, no matter right from that moment on to the rest of our life, it's no different whether we go out for dinner together.
Yep.
If I'm hating on you, what kind of a dinner, what kind of digestion am I going to have?
Right.
If I love that we're together, if we eat together, and I love that connection, it's from the very same, it's from that moment one, yet you pull the baby away, the nurse pulls the baby away, baby cries. Baby doesn't cry when you pull them out.
Right.
Because they instantly connect with their mom.
Yep.
Yet you pull the baby away, the baby cries. Because they need connection.
Yes.
And they need physical touch.
Yes.
And you would argue they need whole foods, right? And that's, without making things too complicated, that is what we need.
Yes. And I saw that in practice. It was one of my proudest times in my profession, in my career as a massage therapist during the pandemic, when we weren't allowed to practice for the first 3 months of the pandemic in 2020. And I was lobbying behind the scenes a lot to get us back to work, because I knew that we were essential. We were essential in a time of disconnection, for healing, for anxiety, for humanity, to be laying our hands on. And it was one of the most difficult but most rewarding times of my career, was laying hands on people during the pandemic. You know, with masks and all the things, but it was more about the connection that was being made. I couldn't agree more. And I'm glad you said that, because it is simple and it's attainable for everyone. But sometimes we overcomplicate things.
And we're still dealing with the trauma of
that disconnection. 100%
right?
we are.
And then our phones, again, trying to disconnect us from actual things, actual people.
Yep.
But the more our struggle in the future will be to continue this connection.
Yes.
And the connection is so important.
It is. It is. So I loved this question because I believe in it. Do biohacking tools like red light therapy or cold plunges actually work?
Yes.
Yes.
Yeah, they work.
Well,
and they work because they are, again, we're talking about sort of the physical connection, the mother's embrace.
yeah.
Within the greater context, we are in nature's embrace.
Yep.
Right? So when we walk in the ocean, our heart rate variability changes, our heart rate changes, everything changes.
Yes.
No different than a cold plunge. And I like the fact that biohackers are trying to take sort of nature cure modalities.
Yes.
Like red light, because it's hard for us to wake up and look at the sunrise.
Yes.
But you can turn on a LED panel now.
Yes.
And
or you can wear it like I am.
Wear it, and you can get the same net effect.
Yes.
So you can, hard to jump into an ocean, but you can have a cold plunge.
Yeah.
And for those, that are wearing sort of, for all the biohackers that are sort of checking their heart rate variability or their heart rate or their respiratory rate, you'll see those changes instantly. And again, those are physiological modalities like exercise, and it can make such a massive difference.
Yes.
And yes, so some of those modalities are really, really, really cool.
Yeah. Yeah, I know both you and I'm wearing a patch right now that has been not only a game changer for me, but many of my patients that have used it. And I'm going to be sharing more about this because some jaw-dropping results, quite frankly, and really utilizing and the light within us.
Yeah.
Right? To change the mitochondria, to impact stem cells. It's really cool stuff. And there's so much more research being done and looking for. So I love that. So before we finish up today, I do want us to talk about the work that we're doing together and the excitement of the future. But I want to share this story with you because it was so impactful for me and brought me to tears. And so you mentioned complementary medicine. And for years, I have talked about being, complementary medicine. I hated the word alternative because I never believed, even when I first opened my clinic and I wouldn't hang my diploma in massage therapy because it said masseuse. And I never ever believed I was a masseuse. Until I was under that Health Regulations Act, I proudly hung it. But I always believed that massage therapy was at the center of the integrative health model from day one. So using the word alternative meant you saw me, the massage therapist, or the doctor over here. So I didn't buy into it. So I used the word complementary.
Right.
I recently had a conversation with an emergency room physician that's been practicing for 20 years. And he heard my story and he sees the FAM movement and wants to be part of it. And he said to me, Margaret, can I challenge you on some of the words you're using? And I said, absolutely. I'm always here to learn. And he said, I've been practicing. I went into emergency medicine because I really wanted to help people in their most vulnerable state, which is admirable. He said, but unfortunately, for the 20 years, that's not what I've been doing in the emergency department. 80% of the time, this is his words, not mine, 80% of the time, the people that are coming through the doors of an emergency room, when I really step back and look at my training, they could have been prevented. I call it the opportunity gap. You just described it beautifully by checking things earlier and getting people into action. He said, so I'm not really putting my skills to use in an emergency medicine kind of way, which we need. And it's an important piece because we haven't dealt with lifestyle and prevention. He said, but I'm going to challenge you on, I understand why you call yourself a complementary healthcare professional. I wasn't prepared, Dr. Rallis, for what he said next. And that was this. He said, I know why you say complementary medicine because you've been beaten down by conventional medicine for your entire career. And he didn't say it in a way that it was accusatory of the system we exist in, because there's a lot of good in it. But what he said next blew me away, and you are going to love this. And he said, I would like you to now start to refer to yourself as primary medicine, and we're complementary. Let that sink in from an emergency room doctor. Talk about this FAM movement, breaking down silos and igniting conversations between healthcare professionals that may have otherwise not had a conversation. And for him to recognize that nutrition and mindset and connection and touch and movement is healthcare. You said that in the first show that we had together. And so there's hope. And the reason there's also hope, you and I are both on and we want to give a shout out to Toronto Metropolitan University School of Medicine is opening in Brampton, where I practiced for 30 years. And why am I so excited about this? Because I didn't know in my lifetime, in my career, that I would see this, and that is this. It's the first medical school of its kind to really be putting emphasis in the curriculum on teaching the future doctors and exposing them to a lot of the things that Dr. Rallis and I, and what we talk about here in PHAMCAST, integrative preventative measures. They're not taught that in a curriculum typically in medical school. I've had a friend that's a doctor said to me, I feel like a glorified pharmaceutical rep. And don't get me wrong, there's a place for pharmacology. We need pharmacists. But this medical school is now going to have the future doctors of this country that have experienced not only being trained, but maybe have experienced a REMS bone scan, red light therapy, a cold plunge, massage therapy, IV therapy, all of the things. And for me, this mission, and I actually get tearful, I started this mission so my kids and future grandkids would exist in a different system. And person by person, ambassador by ambassador, viewer by viewer, politician by politician, together, we're making a difference. I am so honored that you're on that committee with me. I am so honored to learn from you every single time we talk, whether it's with a camera or not. And I know we're going to attract more people to this mission. And together, we're going to make a difference. Thank you.
Thank you too, Mark. Bless you too, for you live and breathe it. And it comes across in every single interaction. And it's pretty obvious to see how you attract and why you attract the talent that you do. And I agree, things are changing. 2 of our medical students that did rotations at our clinic, one just got started in the residency, Johns Hopkins in pediatric pathology, and one in anesthesiology at UMass, I think in Hartford. So to see those students that were in our clinic now in these positions of really great authority and will be in great authority, it tells me that things are profoundly changing.
Yes.
And to see the new medical school in Brampton reach out and want us to be a part of them as much as them to be part of us.
Yes, better together.
Yeah, it's hard not to feel this seismic shift happening.
Yes. Thank you. Well, if you liked what you heard here today, or if you've learned something, please, the one thing I ask you to do is share it. Share it with somebody that needs to hear it. Share it with change makers. Be part of the family. PHAMILY, because together we can change the future of healthcare in this country and beyond and heal the world. There's never been a more important time to do so. Thank you, Dr. Rallis, for being here. For all of you at home, stay in touch, stay connected, and we'll see you all next time.